All right, when you're setting up your IV fluids with both the bag and the administration set, hopefully you feel pretty comfortable with your calculations and how to figure out which size of a drip set that you need. Most of the time we're only going to have maybe one or two different sizes of fluid bags available. Obviously they make 1 liter bags, but we don't usually need 1 liters of fluid to go into a patient since they're not under anesthesia that long and they're not staying hospitalized. So most of the time we're going to order a 500 ml bag or maybe the 250 ml bag for our little small patients. So after you've selected the size based on the size of your patient and the fluid rate and the amount of time that you're going to be under anesthesia, hopefully you've also figured out which size drip set that you would like to use. And we don't always keep everything in stock. We're always going to have the micro drip sets. So how do I know that this is a micro drip set? Well, it does say right here 60 drops per ml. So that's one place that you can look. But let's say that this was already out of the package. Then the other way that I can look at that is, hopefully you can see that, is that little metal piece that's coming down that's going to slow down the size of your drop. And so we'll compare that to, say, a 10 drop per ml set, which again, you're going to look on the packaging. But once you get these out, it's kind of hard to tell other than this one does not have that same little metal piece that slows down the size of the drop. So this is the micro set with a little metal piece, or sometimes it's a little plastic piece, and this is not a micro drip, this is a macro drip set. So we'll put this one off to the side. And so if you've never set up fluids in an administration set, that's okay. This is a great time to practice, especially before you head out to summers and working in clinics. You don't want to do this wrong and waste the client or the clinic's money. So we're just going to open up our bag. You want to make sure that you keep everything sterile so you can pull this out. It's kind of fun to do. And just set it down. Again, don't let anything touch that area. We're going to be spiking it with this fluid administration set. Say that we had a small patient, we're going to use a micro drip set. So again, you're not touching that with your fingers. You want to keep this all nice and sterile, and you're just pushing that in until it makes a connection there. So now it's opened it up. Now we do need to get rid of all the air in the line. So I'll actually go ahead and hang it up over here because this is where we're going to hang it for our patient. And so we want to get all this air out. We don't want to cause an air embolism. And so save this little blue piece. You're going to need it. So just hold on to that. This is kind of like your complete on or off button. So right now it's completely off and now it's on. So we've just got to wait and get all the air out. Sometimes I squeeze this a couple times just to make sure I've got a little bit in there. And now I'm just waiting for all those bubbles. So I see some bubbles here. So a micro drip set, it's going to take a little bit longer than a macro drip set, but we want to get all those bubbles out. And always try to do this over a trash can or a sink table so you're not making a big mess on the floor. Once I've gotten the air out, then go ahead and close it back off because you don't want to keep leaking. And then the last thing that you want to do is you want to recover this back up. Some people will put a needle on it, but you've already got this, it's right here. So just close it back up. That way you can hang it and now it's ready for your patient if you need to step away for a little while. The other thing to think about is actually setting your drip rate. So let's say that you wanted 1 drop per second. I'm just going to pretend like it's hooked up to a patient. So we would make sure that this is open. And then we would want to use our little dial here. So right now it's in full swing, so we're going to slow that down a little bit. Let's just say that we wanted to do 1 drop a second. So 1 1,000, 2 1,000, so I need to speed it up just a little bit. Just got to play with it. It's just a little hand dial. So 1 1,000, 2 1,000, 3 1,000. So that's about 1 drop a second. Let's say that I wanted, I don't know, 1 drop every 3 seconds. So then I need to slow it down. So I'd tighten this a little bit more. And then I just count. 1 1,000, 2 1,000, 3 1,000, 4. So maybe just open it just a little bit. 1 1,000, 2 1,000, 3 1,000. And that's all there is to it. And if you want to be able to walk away, you've got it set, and so you're ready for your patient. Again, just close it off, cap it, keep it clean, and now you can go set up other things, but when you're ready to hook it up to your patient, all you got to do is just turn that little on button or that little on switch there, hook it up to your patient, and it's ready to go at the rate that you wanted it. Another thing you might want to think about doing is having a little Sharpie marker or a pen and go ahead and mark where your fluids started at. Because sometimes you'll take half a bag that's already used and you don't really know where it started at. So if you put a little mark and you know the date or your initials, then that way you always know where your bag of fluids is starting. We do have a few IV fluid pumps. We don't want every student to only know how to use fluid pumps. We want you to always be able to calculate and also administer the drops per second accurately. That's a very important skill before you head out into your clinical year. But a lot of places are going to have a fluid pump. This is just one brand. This is called a Heska pump. So they are really only compatible with the Baxter drip sets, but thankfully that is a Baxter drip set. What we found is that some of the other sets, it wouldn't administer the amount that it said it would. So if you do want to learn how to set these up, let's say that you know that you're going somewhere this summer and you really want to be able to impress your technicians that you're working with that you know how to use a fluid pump. They're all a little different, but they all kind of have some similar principles. You just push that little door to open it up. I'm usually just hanging these on my machine here just so it's ready to go. You're going to need to feed this through here, so I'm going to kind of move our stuff out of the way here. So it'll tell you the direction of flow. So again, this is going towards your patient. So it's coming out of the bag and it needs to be able to flow here. So you don't need to make it too tight, but you want to make sure you have plenty of room for your line to go into your patient. So you got that flow direction right there. If you put it the opposite way, it'll start pulling blood out of your patient, and then you just close it. You'll turn it on. It'll warm up just for a second. And so this is set to be a micro. I don't know if you can see that, but since it is a micro drip set, which is what we're using, a 60 drop per ml, otherwise we need to switch it back to a micro, or a macro drip set, excuse me, if we're using like the 10 or 15 drops per ml. So right now it's set at 10 mils an hour. If I wanted to go up to 11 or 12, whatever I wanted to take it down to. Once I go below 10, I can do with 1 decimal point. Let's say that I wanted to administer 9.1 ml, very specific. Maybe I had a small patient. So once I have the rate set, and you can always look on the left side here, it's lit up in green. It says rate right there. I'm going to hit select. It's going to tell me the time, so that would be over 2 hours and 5 minutes. Sure, if you just wanted it to be 2 hours, that's also fine. The next thing is the volume to be infused, so hit select again. So now I want 18.2 ml, so again, that's 2 hours worth. That's fine, but if you wanted to set fluid boluses and things like that, that's where you could do that. And then the last thing is volume infused. So at any point, you can tell how much has gone into your patient. So when I'm starting, I just go ahead and clear it out. So that way, now I know that I hook it up to my patient. At any time, I can see how much has been given. When you're ready to actually, you've got it hooked up to your patient. Let's pretend it's in our patient here, and you're ready to actually start it. Then all you have to do is just hit this run hold. But you need to make sure that it's wide open. If this is closed, or if your patient has a T-port and it's closed, it'll start beeping at you because it detects the occlusion. So make sure that that's open. This is open, and then you just hit run. And as long as this little bar is moving right here, then you know that your fluids are going into your patient. So that's really all there is to a fluid pump. Different brands look a little bit different, but they've all basically got the same functions. Anytime you want to stop it, you just hit hold. And if you wanted to completely turn it off, but it might lose the settings that you had set up. If you need to plug it in, it does have your plug on the side, and it'll beep at you. It has a little battery indicator when you need to actually plug it in. So those are fluids. Again, the most important thing is being able to correctly set up fluids, both calculate and administer correctly the number of drops per second that we want for our size patient, to not inadvertently give too much fluids, but also if you're not administering, if you think you're giving fluids but they're actually not running, that's also a problem as well. So we want to make sure that you're able to do both of those in Junior Surgery Lab.